Now, Medicare versus the long-term care reality, I experienced this for over 20 years working with my clients. Many people don't know the difference even just between Medicare and Medicaid. They confuse them and interchange them all the time. So when they think that Medicare covers long-term custodial care, they have to understand that Medicaid was designed for acute and rehab needs, which is hospital, skilled nursing, therapy, intermittent home health, and it doesn't cover the ongoing help like ADLs with bathing, dressing, cooking, supervision, beyond brief, and skilled episodes. The skilled nursing portion is also very confusing because it only covers your first 20 days in full after a qualifying hospital stay, and then a 20% copay from day 21 to 100. Then home health care under Medicaid is intermittent and goal-oriented, so the visits are short, tied to a skilled plan of care, aides are part-time, and hours are not intended to replace family or private pay caregivers. And then when we get to Medicaid, that's means tested, so they have to qualify, but it can fund the long-term care services and support patient long-term unskilled needs. The patient must also meet income and asset rules. Home and community-based waivers vary by state and often have limited hours and wait lists. Families above thresholds will also need to spend down or have a plan in place. So the reality is that most families must private pay for non-skilled home care, companion personal care, and for home safety modifications that keep patients out of the hospital. So when care needs exceed what Medicare and Medicaid provide, we can convert a portion of the home equity into a predictable cash flow through a reverse mortgage, which they can take a monthly draw. They could have a line of credit that they can use to cover hours, not just now, but in the future. And this process usually takes between 30 and 60 days, which fits usually, depending on when the family comes to you, common discharge and care planning timelines. So as we know, Medicare handles the short-term skilled care. It doesn't fund the ongoing unskilled help at home. If the family needs more hours, let's get them connected with me so we could explore safe ways to pay for it.